Senator Dr. Rasha Kelej, and creator of our Africa TV show.
All Africa will be part of our show.
The CEO of Merck Foundation.
We want to support girls' education. No to infertility stigma, yes to girls' education. We want to stop gender-based violence, full stop. Number of child marriage will double by 2050.
Hello Africa, we are back with our Africa TV show, Fashion and Art with a Purpose. My name is Brian Mlondo, and as usual, joined by the amazing Dr. Rasha Kelej, CEO and President of Merck Foundation. Welcome to the show.
Thank you,
Brian. She is also the most influential woman of 2019, 2020, and 2021.
Thank you.
But today, what are you wearing?
I am wearing blue because today we are going to talk about fashion and art with purpose to raise awareness about diabetes.
All right,
diabetes
so this is the color for diabetes.
Yes. And of course, this is a Ghanaian Nigerian designer who designed this outfit.
Wow.
And I like, as I said, to encourage all African designers.
Nice.
And I love this outfit very much.
That's
it has
nice.
Memory with me. Because I attended actually Zambia with a former First Lady of Zambia, an event with there, and we discovered that we are wearing the same color and the same material.
Oh.
By coincidence. I'm coming from Dubai, she is in Zambia, and we wear the same dress together.
That's
so,
nice.
Same color. Yeah. So
that's nice. Hey, follow us on all our socials and let's start the conversation. Guess what? Did you know that 537 million people across the entire world are currently living with diabetes?
It's actually 453 currently living with diabetes. They will become 783, which is almost 50% increase.
That's double
by
the number.
2045.
Yeah.
So it is really, really high incidence.
I can imagine it's putting a toll on healthcare as we know it.
So of course, it's a very big pressure because it's a triple burden. If we're talking about Africa, we have non-communicable diseases and communicable diseases and road accidents. And now with a lifestyle, you see that people, unhealthy lifestyle, sedentary lifestyle, no exercise.
Yeah.
A lot of unhealthy food, that is fast food and all this, and this is of course contribute to diabetes. You know, also very interesting number that 70% of the people that have diabetes are not diagnosed. So the numbers we are talking about that we have, for example, a certain number of people with diabetes, 45 million adults that having impaired glucose tolerance who are pre-diabetic, and a big number also have diabetes in Africa, but the majority are not diagnosed.
Right.
That's why we are creating this awareness today, and of course not only today, every day, so we can encourage people to early diagnose diabetes and prevent it. Because if they are having impaired glucose tolerance, means that they are pre-diabetic, so they can be diabetic anytime. So if they don't take care of themselves and eat healthy, stop sugar, stop smoking, limit alcohol intake, exercise regularly, they will become diabetic.
It should be a habit, right? This should be a lifestyle. Let's talk about Africa, Dr. Rasha. 416,000 deaths in 2021. What is Merck doing to just create awareness? Of course, the show is doing an amazing job, but beyond the TV show, what has Merck done?
It's an amazing program. It's called Diabetes Blue Point Program.
Say that again.
Diabetes Blue Points Program. Why it's called Blue Points? Blue from diabetes color, and points that we want to create across Africa, in each country, in each provinces or district, a diabetology or diabetes expert, cardiovascular expert, and endocrinology. So we provided till today scholarship to 604 doctors from the 3 continents, majority in Africa, Asia and Latin America, in English. Portuguese, and Spanish, and French.
Wow.
To be diabetologist, and there's a selection in partnership with the Ministry of Health and the First Lady's offices, yes, in 42 countries, and they select one from each provinces or district as much as we can. Wow. So we give them 1-year diploma and 2-year master degree in diabetes management, in cardiovascular preventive, which is very much related to diabetes, and of course in endocrinology as well.
Right.
So imagine these, when they graduate, what will happen? They will be able to establish their own diabetes clinic, and of course manage community and people with living with diabetes, and early diagnosis, and of course prevention.
And in some of these countries, these are the first specialists the country has.
Definitely, you know it, because in Liberia it was the first diabetes expert. In the Gambia, and the same. In Burundi, the same. Even we established the first diabetes center. These doctors, they established the first diabetes center in Burundi. It was amazing. In Zimbabwe, in what else? Sierra Leone, many countries.
Right.
42 countries.
Wow.
So I think today, because we're talking about diabetes and we want to raise awareness about diabetes through fashion, but before that, we need to call our nutritionist.
Yes.
From Mauritius.
Yes. When were we in Mauritius? 2018, beautiful country.
Yes,
and joining us now is Tanisha Subra, who is a dietitian. She's also a nutritionist. She is very passionate about nutrition and diabetes. You are also the president of the Diabetes Society in Mauritius?
So it's a dietitian association in Mauritius.
Nice.
Fantastic.
What's the difference between a dietitian and a nutritionist?
Well, the title dietitian is actually legally protected. So you have to complete at least a 4-year university degree with training endorsed by a particular organization. Oh. So whereas with the nutritionist, it's actually, anyone can do a course from 1 month to 3 years and call themselves a nutritionist.
I can be a nutritionist.
So you're protected.
I'm protected.
Yes. So I want to ask you, I think in Mauritius we have provided, out of these 609 doctors, 50 doctors with training, because we focus on French-speaking countries and SIDS, which is a small island developing states, which is Mauritius one of them. And of course we had this in partnership with the Ministry of Health. Because we know that diabetes is very high incidence, has high incidence in Mauritius, is it correct?
Yes, diabetes is one of those diseases that you could probably just see in every single household. So if you go out there and just talk to people about diabetes, you probably have at least one person in their family being diagnosed with diabetic. And this is very, very serious, because we're not just talking about the aging population now, we're talking about kids, we're talking about teenagers, we're talking about early adults that are just getting into that peak. And if we're talking about the new generation, I think there's going to be a huge burden on health as well, because there's so many people that diagnose. And with diabetes as well, when we talk about diabetes, it's not just diabetes, the complications.
Definitely.
That
so
comes
how can
with it.
people prevent diabetes and early diagnose diabetes?
Definitely what we need to be careful about is our lifestyle, because you talked about it. Lifestyle is the first and foremost way to actually deal with it. So definitely no smoking, no alcohol. This is going to be really important. Exercise. Change your mindset. Mindset is a very, very important thing. So change your mindset. Healthy foods, but also taking into consideration, because we know from a cultural point of view, same with Africa, Mauritius also has got a culture of food. So we do have cultural foods, but trying to move away from these things doesn't mean you're leaving your culture. It's about embracing better habits that's there, and definitely a lot more water over soft drink and juice.
And stop sugar. I think sugar is a man-made sugar. So maybe focus on fruits or natural sugar more.
Definitely. When we're talking about sugar, we need to bear in mind that sugar doesn't bring us any nutrition. So rather get your fruits naturally, then you're getting your sugars, you're getting your whole grains, you're getting fiber, which are all these essential elements that are actually going to decrease your risk of getting diabetes. And so that's a key
Do you
point.
know when I turned 45, I stopped sugar totally from my diet. Totally. I don't have even single sugar in my diet.
Only the natural
fruits and so on. And of course, I felt much better. First of all, I lost 4K just immediately
Easy.
without even exercising or anything. Although it is difficult because our metabolism rate when you are older is getting very low. But it's a 4K just dropped immediately. I feel actually energetic. I feel actually younger as if I am 35.
Yes. I
So,
wouldn't be surprised.
It is amazing transformation in no time. After 3 months of stopping sugar totally, I felt suddenly 10 years younger.
Wow, that's so cool.
And full of energy and lighter. And I
Definitely.
think better.
Yeah.
My memory
Don't
is,
have the brain fog
yes,
that is there.
my
Brain
memory
fog,
is just been sharpened totally.
Yes.
So I really recall everyone, if you can, if you stop sugar, your life will be transformed.
Definitely. And when we're talking about sugar, it is very important to realize that because we've got so many people suffering with diabetes, there's a lot of marketing around it as well. So a lot of products have been rebranded as sugar. So coconut sugar, agave syrup, all these things, these are still sugar. They are still adding in not enough nutrients in your diet, and they're still going to lead to diabetes. So these are the things that you need to be careful about in terms of the and limited
and
completely.
what is quickly in 30 seconds early detection? What symptoms that people know that I am diabetic, I need
So
to...
some of these ones would be probably getting thirsty. So if you're really looking for water more often,
Getting thirsty all the time.
thirsty,
Thirsty,
excessive urination, for
exactly.
example.
So waking up nighttime,
Constant
constantly.
hunger.
These are the keys.
But I could just be
blurred vision and
naturally
all
a
this,
a foodie.
Yes.
And I'm
No.
constantly hungry.
If it is actually more than natural or normal,
Okay.
Your normal self.
Yeah.
So, and this is early detection to diagnose. If you have this, you please go to the doctor
and get a blood test done. So even if you don't have these symptoms, get a blood test done yearly because
to
just
ensure
to
that
rule
you're not
out
pre-diabetic as well.
Exactly, because the good thing with Mauritius now, the government is actually doing regular checkup with kids. So and now we're seeing, I think it's
with type 2.
Exactly,
Which was not the case before.
Definitely not the case.
And this is, I think, all because of the bad habits in the fast food and the lifestyle of computer, not moving, not playing, no physical activities. I think
that
we
is
have
incredible.
we
Hey,
have
you
to
can
break
check
at the
out
moment,
you can check out some of this information on our social media platforms, and if you're also maybe a practitioner, share some of the experience that you have
and
in
you can
your
apply
own country.
also for our scholarship. And let us break now to see some testimonies of the trainees and Merck Foundation alumni after they got the diploma and the master degree of diabetes.
My name is Dr. Joe Alote. I'm a senior house officer at the Greater Accra Regional Hospital in Accra, Ghana. I was a beneficiary of the Merck Hypertension Award, which was a postgraduate diploma in preventative cardiovascular medicine.
I have significantly improved my time management skills and constantly try to keep up to date with the latest recommendations and guidelines for especially prevention of cardiovascular disease.
And this is important to us because in most of our countries we see a convergence of infectious diseases and cardiovascular disease. And therefore this master's training was very key in equipping me with knowledge and skills of managing cardiovascular disease, especially among people who have had a history or have concurrent infections, which is something we are beginning to see quite a lot in Uganda.
Yes, it has greatly impacted in the way I manage my patients. And since I'm also involved in teaching the interns, I was able, through greater understanding and gaining knowledge, I was able to also influence my interns to improve their knowledge on the care of the diabetic and my hypertensive patients.
It has improved me in my approach towards people with diabetes and hypertension, or skills that has been lacking in our country.
In fact, right now I'm also running a diabetes clinic at the hospital that I work, and The reason I was even trusted to begin this diabetes clinic is because of the knowledge that I acquired from the diploma.
This diploma gave me the opportunity to learn the latest advances in diabetes management, and not only that, I became a better clinical writer at the end of this course.
For me, I could get more knowledge in preventing and treating cardiovascular diseases, including hypertension and its complications.
So far, my education in preventive cardiovascular medicine has allowed me to provide better evaluation of my patients and also provide them with evidence-based counseling with regards to their health, especially cardiovascular health.
11 from our medical doctors staff will have a grant, a scholarship to learn diabetes. This program will help them to strengthen their skills.
Thank you so much, Merck Foundation, for giving me this opportunity. There was a lot of new things I learned, which is going to go a long way to enhance my care of my patients and also to boost my confidence in the management of diabetes.
There you go. You can actually also follow our social media platforms and apply for the scholarships. A lot
Yes,
of work
what
is
do you
being
think
done.
about the testimony? It's amazing, huh?
They are amazing. And I know particular doctors
We're
in
making
my country
history,
who have...
and now we have also in Mauritius. So actually, I think it will make a huge transformation in patient care in all Africa.
Right.
Well,
since we're talking about art,
yes,
let's invite someone that we've been collaborating with for a very long time. He's featured in 2 songs.
Yes, Superwoman and Girls Can, musician and singer Kwesi from Ghana. Kwesi, we work together in many projects. And there is another project which is called My White Army about coronavirus. We will have it in different episodes. But these songs, how do you see this contributed to the cause? Either Superwoman to women empowerment and stigma of infertility. The other one, girls' education.
Both, all the songs have done amazing work. I mean, several people I know in Ghana that, of course, have suffered from infertility.
And also girls' education.
Yes, girls' education. But from infertility, people saw that their lives are worth more than just giving birth. Then we moved to girls' education. I mean, people are seeing the need to educate their children because in certain countries, people find value in men than women, and so people put investment there.
But music and art in general and fashion can contribute to in a very soft way that can come to people's hearts and change the culture. What about diabetes? Do you think music can do something for diabetes? Because I want to work on a song with you about this.
We can't wait. I mean, I listened to your interviews this morning, then I realized that regular exercise can actually help in preventing or sustaining life.
Offline, can we work on a lyrics and a music tomorrow and we do it for social media?
Actually tonight.
No, we work together.
Definitely. We always work together. You do amazing with directing these things.
Right away. Stay tuned.
Yes,
stay
definitely.
tuned. There's a song will come out.
Line for me to
definitely. Yes. Tomorrow you hear something.
Something like sugar-free, baby.
Yeah, sugar-free.
Yes, sugar-free is nice.
Now we have 2 fashion designers, one from the Gambia and one from Mauritius. And we want to watch their workshop at the moment, and we'll come back. They're working on design to raise awareness about diabetes.
No more diabetes, reverse diabetes, goodbye diabetes. We can make it work, we can make it work, we can make it work, we can make it work. Push back diabetes, no more diabetes, reverse it, we can make it work. Can make it work, can make it work, can make it work. Can do anything we put the mind to. The body exercise and quit the smoking. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Better choices every day will make the difference. Exercise every day to make the difference. No more alcohol, No more cigarettes, skip the sugar drink.
As we've seen many of the nice designs with our designers, I have also my own design that I would like to introduce to you and share it with you. And here is manage your diabetes. It's not a managing your diabetes is not a science, it's an art. Here and here, exercise regularly, eat healthy, stop smoking. It's very important to prevent diabetes and to manage diabetes, that stop smoking. In fact, to manage all non-communicable diseases, including hypertension, cancer, smoking is destroying all body organs. Limit alcohol intake.
Defeated. If we make the choice, we can make it work.
We can have specialists and diabetes clinic all around Africa. We choose them, we select them in partnership with the ministries of health of each country and also with the First Lady's offices to ensure that they're coming from different provinces, different districts, so it can be a very important Blue Point, Diabetes Blue Point program that can cover all Africa, different countries, different provinces in each country in our Africa. Wow, it's a really nice workshop.
Yes, yes.
The designs are amazing and the wings.
I love that. I love that they've also done something for the men. Yeah, because...
Yes. Let's see them.
All right.
They will talk about it.
First, Gabriel Fra.
From Mauritius.
From Mauritius.
Wow. Yes. Hi. Please. And your design?
I'm a designer.
Yes. The model is from Nigeria as well. So we have a Pan-African thing.
Yes.
I love sugar-free for diabetes. It's amazing and it's really, talk about it.
So the outfit was inspired from a traditional Mauritian food, which is cotton candy. So there you can find it at every corners of the street.
Yes.
And kids really love it. However, if we eat too much of that, it starts to bring in the diabetes disease.
Yes.
So that's why I've used a velvety material to represent the cotton candy and also incorporate it in what I'm doing right now, that is menswear with African fabrics.
And sugar-free.
Yeah.
What do you think about that?
I think that's incredible.
It is
Honestly,
really lovely,
especially with the cultural part of it, I think it's beautiful.
And you can have this sweet sugar-free.
Exactly.
Yes? It's amazing. I like it.
I love that.
I love the messaging. Yeah. It's very clear.
Can you wear
yes, I can. I've actually
in your
decided
video.
to. Yes, I would love to do that in the.
And then we do in the video clip. In the video clip, we have to do this video. Yes.
So, this
so we will collaborate. So now collaboration between Ghana and Mauritius.
Yes.
So the Mauritius will be the design artist. And the Ghanaian Kwesi will do the musician and the song.
Yes.
From Egypt, I will direct it.
You'll
and Uganda, Brian
I'll just
will
stand
present
there.
it. Yes.
As always.
I love that also because, you know, young people, more young people are getting diabetes, but you still look cool, you still keep the youngness, but also pass on the message with
And
the African,
glasses?
with the
The
shades
glasses.
really dope.
It's lovely. So what do you say? The chain also and the Africa chain. Oh my God,
chain.
it's really
Absolutely
lovely. Can we call the next designer?
All right, our next designer is from the Gambia, Kine Mane.
Wow.
Are the wings heavy?
Blue. You can go up in the next step. Yes.
Yeah.
It's blue, of course, diabetes.
Yeah.
And tell me more. It's lovely.
Thank you.
How did you get the design?
Okay. Basically, the inspiration was from.
Can you raise your volume a bit?
Okay. The inspiration was from a bit of a sad story that my grandmother died due to a diabetes disease.
Also.
Yeah.
Oh my
so
God.
that was where it came from, like
So
the
sorry to
wings
hear
and
this. Yeah.
it's okay. Thank you. The wings and everything, like a special dedication to her. Like she was really my friend, and that's why I decided to do this. Yeah, the angel thing.
And you
blue
put
thing
the
representing
message:
diabetes.
exercise regularly, eat healthy, stop smoking. It's a lovely dress.
Yeah.
You know, this can be in the celebration of the Diabetes Day.
Yes.
And in any event that you're talking, raising awareness about diabetes, the MC or the event chairwoman can really wear a dress like this, and it will really be amazing. All the media will capture this, and people will read it, and it will stick to people's mind. You know that subtle messages
in any movie or any event or anything that really change culture, change people.
Yes.
It's amazing.
Yeah.
Beautiful. I like it very, very, very much. I hope that it's my size, but it's not.
Yeah,
it's yours. Super, super small. Although I am fat.
Look amazing on you, though. Thank you, thank
what do you
you.
think
Fantastic
about
design.
It's amazing, huh? It's great, it's great. So can we call Gabriel? You can come here, yes. So we have now the two designs, one for men and one for female, for women. And I'm sure with these ideas you can have many, many, many other ideas. Stop smoking, exercise regularly. What else? Eat healthy.
Eat healthy, sleep.
Stop alcohol, sleep, drink water.
Yes.
Stop sugar. Please, no need for sugar to keep beautiful and slim and healthy. So
healthy. Hey, if you're doing anything in your country to make sure that diabetes is, the numbers are put down, please get into our chat box, talk to us. We see so many of your messages in our social media platforms. We see them and we're going to respond, but talk to us, all right? Let's be the change. And for all of you in the medical world, apply for the scholarships.
And apply for the awards. We have the Fashion Award, the Film Award, the Music Award, and the Media Recognition Award, and Media Training to raise awareness about different topics. So come up with your design, apply to get the award like these beautiful designers from the Gambia and from Mauritius. Please advocate for this in your countries. I want more and more to see creation and art. Kwezi, Best Song Award we have also.
Amazing music coming.
Best Song Award. I want all the singers in Ghana, Nigeria, Liberia, Sierra Leone. You are responsible for this. Yes,
we'll catch you next time. Bye-bye.
Bye.
No more diabetes. Reverse diabetes. Goodbye diabetes. We can make it work. Can make it work. We can make it work. Can make it work. Push back diabetes. No more diabetes. Reverse it. We can make it work. Can make it work. Can make it work. Can make it work. Can do anything we put the mind to. The body exercise and quit the smoking. No more alcohol. No more cigarettes. Skip the sugar drink. We can be sugar free. Better choices every day will make the difference. Exercise every day to make the difference. No more alcohol. No more cigarettes. Skip the sugar drink. We can be sugar free. Choose a better day plan. And quit the smoking. Say no more alcohol though. Exercise every day. No more diabetes.
With our Africa TV show, Fashion and Art with a Purpose. Dr. Rasha Kelet, CEO and President of Merck Foundation.
Work, can make it work. Push back diabetes. No more diabetes. Reverse it.
Today we are going to talk about fashion and art with purpose to raise awareness about diabetes.
Put the mind to the body exercise.
Even if you don't have these symptoms, get a blood test done yearly.
Skip the sugar drink, we can be sugar free. That choices every day will make the difference.
And apply for the awards.
Make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. And quit the smoking. No more diabetes, reverse diabetes, goodbye diabetes. We can make it work, we can make it work, we can make it work, we can make it work. Push back diabetes, no more diabetes, reverse it. We can make it work, we can make it work, we can make it work, we can make it work. Can do anything we put the mind to. The body exercise and quit the smoking. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Better choices every day will make the difference. Exercise every day to make the difference. No more alcohol, no more cigarettes. Skip the sugar drink, we can be sugar free. Choose a better day plan. And quit the smoking.